It's 6 o'clock. We're going to call a meeting order. First item will be roll call.
Starkey?
Here.
Gray?
Here.
Nail? Me?
Here.
Walker?
Here.
West?
Here. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Please swear to me.
Heavenly Father, we ask that you put a hedge of protection around the men and women of PCAD. Alert the ambulance drivers to the dangers of the road and give the medical personnel the wisdom they need to treat the citizens they serve. In Jesus' name, amen.
Amen.
She does better than John Hill.
Motion to approve the agenda. So moved. All in favor, say aye. Aye. All opposed, same sign. Everyone's had a chance to review the previous minutes. If there are no additions or corrections, they'll remain explicit. We have no visitors or public comment or unfinished business. Take a motion to adjourn the outgoing board. So moved. Second. All in favor, say aye. We'll call the incoming board to order, and the first item will be to elect officers. Floor for nominations.
We can just do this easily. I motion just to keep it the way it is.
I second that.
With one explanation. What is a custodian of records? Is that Kings? Okay, I was just trying to figure out what that title was. Thank you. Yeah, I'd second that motion.
Motion second to leave officers as they are. All in favor, say aye.
Aye.
All opposed, same sign.
That's trying to.
Ordinance 2026-01, the conflict of interest policy. It's the same policy that's been in place for a long time. Take a motion to approve that ordinance if there's no questions.
So moved.
Second.
All in favor, say aye.
Aye.
All opposed, same sign. Resolution 2026-03, authorize officer to sign certain bank documents and checks.
This is the same folks, right?
Yeah.
Chairman, Vice Chairman, and myself.
Yes.
So moved. Is there a second?
Second. All in favor, say aye.
Aye.
All opposed, same sign. Resolution 2026-04, authorize officers to view electronic bank records. Page 9.
No wording has changed since last time.
Right.
Okay, so moved.
Second. All in favor, say aye.
Aye.
Resolution 2026-05, authorize officers to access safety deposit box, page 10.
Okay, so this one's chair, vice chair. I don't know, chief is on there. I move to approve as well.
Explanation.
Yes.
I was reading this. Are any two of those three, so. Is it either and the chief or any two of the three? Or is it all three in order to explain what constitutes full compliance?
Any of the three?
So one person can go in and open the safe deposit box.
So I've not been down there since I've been the chief. When I was the assistant chief, I did go with Dirk down there and got the safety deposit box, and it was just gonna
It would seem to me that you should have at least two.
and that time there was both of us, I mean, I don't know.
So I don't know if I don't know how it's been, but it would seem to me that two would be better than one. In case there was something missing of some sort. And I'd feel better if somebody was with me if I went down and opened it. I don't even know what's in it, but I'd sure feel better if I wasn't alone. Because I could be getting set up or something, you know how that goes. So I don't know, it doesn't specify if all three or any two of the three, if it's the chief plus one, or how does that work? How's it worked in the past? You don't know, you haven't been there.
I mean, that's the only time, I've only been there once. And that was
It's always been that any one of the three can go.
Okay.
I think you have to show ID and sign in.
Yeah.
Right.
Yeah, there'd be a record of it.
Yeah, well, I remember when I was a power of attorney and I had her bank, stuff like that. And she was having some problems with her mental health, and so I made sure that when I went to the bank to get the list of what was truly in her box, I went with not just her daughter, but I asked one of the bank officers to come in too. And then we signed the paper just to make sure, because one of the other family members was claiming somebody had been in there and taken things out of the box. So I made an exact record of everything that was in there, but I didn't want to be the guy that went in and did it by myself.
So I get it, and I don't have a problem with that. I just want to make sure it's not too restrictive. I'd say 2 out of the 3 because.
That's what I'm thinking.
And then I would say to make it non-restrictive, not to have to be the chief and one other, just in case. I mean,
Any two of
any
these
2 or
three,
3.
I can live with that.
So can you make that change to the ordinance on that motion? And it's a second.
Okay.
All in favor, say aye.
Aye.
All opposed, same sign. Move on to officers' report to chief's report.
Mine starts on page 11. Nothing crazy happened this last month. I did put some pictures in of the progress on station 3. It's coming along nicely. The asphalt's been laid. There's markings on the parking lot now. Floors are done. They're putting ceiling tiles in, working on plumbing. I was out there yesterday and they were working on getting the water softener and hot water heater put in. I believe tomorrow the IT rack shows up. So I mean, it's coming along nicely. Call volume, Pettis County had a total of 20, or has had a total of 22,356 calls. Windsor's had a total of 359 calls so far this year, for a total of 2,715. Currently, I'm tongue-tied. Lowe's, the mileage, you see unit 11's on there with 217 miles. It is here. It's almost in service. I gotta get a radio installed in it tomorrow, but after that, it'll be ready to rock and roll.
Was that a pun?
Huh?
Get the radio installed so you can rock and roll. I see what you did there. All right, good.
Medical supplies, nothing to report. Medical equipment, nothing to report on that. ENT class completed. They'll be taking their skills test, I believe, the 18th. They'll be doing that in Clinton. Last week, Justin did a community CPR class out at Impact Signs with, I want to say it was the Optimist, I believe. But that went off really nicely. It was well received. On 13, you have the heat map, which stays pretty consistent what it has been. You can see out there off of TT, the nursing home and the assisted living place keep us pretty busy. That's that red circle out there to the east. Call volume by city. One thing, this doesn't account for the calls that Windsor runs. So like, that's why there's no Green Ridge calls and stuff like that, because it's pulling from the CAD data and there's no CAD data for Windsor. So, all the rest of those graphs are pretty on par with what it has been. It was a slightly busier month than what it has been since the first of the year. We had 967 calls, which is above what it was this time last year. But as far as everything else goes, transfers are staying pretty consistent. 911 calls are up there. And the same for Windsor. Of course, they're up quite a bit more than what they have been, but they started taking the transfers out of Bothell. So that changes that call line for them. I don't think I have anything else. Does anybody have any questions?
I do.
Sir.
Page 12. Under the education number 1. It's a multi-part question. Is that EMT class instruction limited to just our personnel? Or does it include people from other districts?
As far as like people teaching?
No, taking it.
Oh, I mean, it's people from, I think this last class we had people from Marshall in it. There was a handful from here in Sedalia. But
And the instructors, are they in-house here?
Yep.
And then when they take their state skill test, is it pass fail or is it quantitative, the results?
it's pass-fail.
Pass fail, okay.
I mean, there's critical fail points that you hit that no matter what.
Last part of that, do we track our people who have been instructed by our people through the years? Do we know what, do I have 100% passing on, or is 50% or 60, or since we've changed it? See, I'm just trying to get a track record if we're doing this instruction with our people. And I'm wondering if we don't track the performance of the classes from year to year or anything.
Well,
like
we do.
that.
I
We
mean,
do, okay.
Yeah, and I don't know what those numbers are. It's not.
No, I don't need the numbers. I just think it's good if we did track that.
Part of us keeping our training entity license in order to teach, we have to have a good pass rate in order to maintain that. If we don't keep that pass rate, then they pull our certification.
Just on the outside chance that those scores were numerical, then you'd be able to track that through time and see if we're getting better applicants or better training or what. Yeah, okay. I just was wondering how that worked. Thank you.
Any other questions? I do. Page 17.
Okay.
No, this is an easy one. I love data. That's what I do for a living. So it always interests me. I love this graph. I mean, it gives you the overall view, the unit view of time on task by action.
Mhm.
I mean, it's a little hard to read because of it, but
You're colorblind?
yes, but you get the gist of it. Not that I need to know anything specific about it, but do you all use these things to analyze, like, how, do you use these statistics, or these numbers, the time on task, or anything like this to kind of review how y'all are doing, handling procedures, or like, does it give you any insight to, does it give you any insight into what's going on, or what we could do better, or are we meeting things?
It does, so I mean, it gets, like, for this here, I pay attention to this when we're watching, like, for like crew fatigue.
Okay.
And stuff like that, and it kind of gives us an idea, and it makes sense, because like, if you look at 50 and 51, those are the Windsor trucks, their time on task, and then their destination to available is a lot longer than everybody else, because they got further to go to get back home. But, you know, I look at that as you look at that, and then like the days of week, what our busiest days are, that helps us guide which days we're gonna run the 12-hour truck. So we're hitting it on the right days where we actually need them versus not.
Awesome.
So I mean, that's how I use it. I mean, bigger systems use it way more in depth than that, but we're not that big, so.
Cool.
I use it just basically, mainly make sure we're not overworking by too much.
Awesome. No, I was just curious. That's great information. So,
Any other questions? If not, we'll move on to payment of outstanding bills. Are there any questions on those bills?
I wanna go over the Missouri GMT, the office, who is it, office? Assistant treasurer, that 181,000, I just wanted to go over that with you guys, so you are aware of what's happening. So, I think was just last meeting, it seems like a long time ago, that we talked about the GMT and the changes. So this GMT is for the Medicaid managed care. So there's two portions of Medicaid. Medicaid managed care is where the state pays private insurance companies a fixed monthly amount to manage care for Medicaid members. So that's United Healthcare, Home State Health, Healthy Blue, all of those plans, we have Medicaid managed care. And those plans cover different sections of the Medicaid participants. So the fee-for-service covers disabled, elderly, low income. The Medicaid managed care is pregnant women, children and families, low-income adults, and then that includes the Medicaid expansion. So for this GEMT, we don't do any reporting. The state did all the reporting. And they just sent us this letter. Surprise, here you go. Here's what you're getting. Here's what we recorded for you. So I called the state because this was all of the information that we received. It was this letter. I just got an email and shabam, you're getting $626,000, which that's a great email to get, but I didn't know what exactly it was for. We knew it was coming, but there had been no communication as when it's coming and what it's for. So there is a report that they had to file with the federal government and get approved. So we're getting paid for January 1st through June 30th of 2025 is what this payment is for, which covers 493 Medicaid managed care transports. And the rate that they used for the state of Missouri was $1,638 per transport. I don't know where that came from. That's a conglomeration of the entire state. They came up with that number. So that's where that is based on. There's no reporting that we did. It's just based on the MMIS data. So, and every time that MMIS data, every point in time they run that, they're different numbers. Because I just compared it to what was in the GMT report that we did, the MMIS data, and it showed there was 478 transports during that period. Our internal billing records show, it's written down somewhere in all these numbers, 483. So if they're all really close, the number of transports, 10 or 20 calls. So next year, this year, 2026, it's going to be $1,651 a transport. So they'll be every 6 months, there'll be one of these letters where we're paying over the net federal participation amount. I'm sorry, I said that wrong. We're paying the non-federal share amount, and then we're going to get the net cost of the transports. So the net that we get is the federal. participation amount. So the 181,000 is what's being paid now. By June 8th, all of those health plans are supposed to remit however much transports they have for each of those plans. They're supposed to remit their portion to PCAD by June 8th. Yeah. So there'll be a payment from United Healthcare, from United Healthy Blue, and from Home State Health. The CHIP program is not included into UT. Any questions on that? That's the reason for the 181,000. To get 807 back to net 626.
What was the amount last year per, you said for this upcoming year is 1,651,
It's 1638.
just curious.
Any other questions about Medicaid managed care, EMT, and then any other questions you have on any of the bills, but that one was a new one, so I wanted to explain a little bit.
Motion to pay the bills.
Do we have a second? All in favor, say aye. Aye. All opposed, same sign. New business, PCAD billing, I think, the billing manager.
Okay, so I tried to pull together, just some things that I wanted to go over with you all, as I'm thinking over some things that I've noticed, things I think that you should be aware of. As you know, I started this position back in February, so I've been going through a few things. Just a billing overview for this year, for 2025, January 1st through March 31st, our total call volume for billed claims was 2,974 compared to 2026. That is more, it's 259 calls more than what we've gotten this year. So they're actually down this year compared to last year as far as billed claims more. That could just be that we received more refusals or more limited assist calls, things like that. As far as the claims that are actually getting billed out, we have billed 66 more claims this year than we did last year at that time frame. And then I broke out emergency versus non-emergency, so you can see the difference there. So claim follow-up, right now we're working through denials. That could just be a range of things, for having wrong insurance on file to insurance requesting additional documentation just to basically provide that information that it did meet medical necessity and they're going to reimburse us for it. Insurance changes, we're still working through some of those. Like I said, people at the start of the year to switch over to different insurance. So we're updating all of that. Motor vehicle accidents, following up on these, a lot of these end up going to litigation, so we do have to follow up on them very frequently. I actually this year have received a payment back from 2023 for a claim that was in litigation, so those take a little while, but like I said, we follow up on those. Some issues that we're going through, there has been an increase this year in Medicare Advantage plans versus traditional Medicare. So this is presented to the public as a cheaper option, but it does require higher copays. So our copays last year were right around $290. This year it has jumped to $335. So for these patients that need transported multiple times, that's a $335 copay every time they're transported that's due to us that Medicare does not cover. So with this problem with the higher copays, we have seen an increase in the financial assistance applications just because it is harder for people to pay that higher amount every year. So that is actually the financial assistance application that's across the board. That's not just our Medicare patients, but I've seen more with our Medicare patients than I do with the rest of them. A big thing with denials that we are seeing, there's a new code out there that commercial payers have been using. It's that PR 242 denial. So basically that is a denial code that our commercial payers use for services that are not provided by primary or network providers, which would be us. We are in network with Medicare and Medicaid, but for our commercial payers, which would be like Aetna, United Healthcare, Blue Cross Blue Shield, things like that, they have started using this code rather than some of the codes that they used previously. However, this code is not accepted by a lot of our secondary payers for, like Jamie discussed, Medicaid managed care and traditional Medicaid plans. So this has actually been an ongoing talk with our Missouri Ambulance Association. There is a billing committee that I meet with monthly to discuss the issues that we're having. This is actually a statewide issue. It's not just us, but unfortunately our company noticed it first and we first brought it up to them, and now everybody is seeing this issue. So we have been talking to the Missouri Ambulance Association to try to figure out what we can do to alleviate this issue. So the original information we were given was to contact the commercial payers to see if they would switch that around. When we contacted them, they basically said, this is what we're using, we're not going to change it. So for our secondary Medicaid, we reached out to Medicaid to find out if there was anything they could do, because they don't accept that code, which means they will not take anything on that claim if they see that code on there. We asked if we could change it ourselves. We asked if there's anything they can do. They basically said, sorry, if there's nothing we can do for you, you can try to contract with payers, which leads me up to that. That has become a challenging issue as well. I have tossed around the idea of trying to go into contract with some of these payers. However, it's not really a viable option for us. Some of our other billing agencies across the state have tried this as well, and there are a lot of companies that are not even accepting new providers. So that's not really an option we can go with right now. We did have somebody reach out to the insurance commission to see if they could find another workaround to this, and they are siding with the commercial payers. So we're not really getting any help on that front either. They do think this could possibly become a legislative issue because it is affecting so many people. But to put in perspective, if we have a $1,000 ambulance bill and we send that off to a commercial payer and they use this denial code or apply the entire claim billed amount to the deductible, and they have a Medicaid plan as a secondary, we will receive a $0 payment for that entire transport. And eventually that will either be written off or we will have to send it to the patient if they don't have a Medicaid secondary plan. And unfortunately, this is causing a little bit more on our patients as well. We do always encourage them to reach out to their insurance. And there has been some success with them reaching out to insurance to get those switched. But it's a challenge, and unfortunately, I don't like having to put that on our patients because, it's just a lot of extra work for them. But just so you can see kind of where that issue is right now. On the next page, I have a look ahead. So this One Big Beautiful Bill Act that has passed, there is a possibility that we could see an increase in our uninsured patients in the future. There are several people that could be removed from Medicaid. There are several stipulations to staying on that. That's not something that we're really seeing right now, but it definitely could be something that we see in the future. There are work requirements that will become effective in December of 26. And they have changed as well the retroactive coverage dates for Medicaid. So that was set at 90 days previously. Now they're bumping it down to 30 days. So what that means is we'll have some patients that may not have insurance and they'll apply for Medicaid. Medicaid right now will retroactively cover you 90 days prior. So a lot of people, it takes them a while to get that coverage back to the date they were transported. There's a chance now that that's not going to go back as far. So that's just something to consider. And then the Medicare spending cuts. So right now we have temporary add-ons to Medicare. We are rural, so we get a 3% increase to what our Medicare payments are. That is set to expire in December of 2027. We're hoping that that extends out, but like I said, we won't know right now. And then I have signed up for several different trainings with, just updates for billing to stay up to date on everything. Lauren Moore has a compliance billing audit training coming up this Thursday. These are all free training opportunities, but it's just extra things I can do to try to better my knowledge in the field. And then we have our PWW ABC 360 conference coming up in May. That is a very, very helpful conference. Where we get to kind of talk to some attorneys to find out, what the updates are as far as billing changes. That next page you have, that is a chart that just shows you our primary care mix. So our highest is Medicare, but you can see those percentages there. And then back behind that, there is another chart that kind of breaks that down a little bit further, so you can see how many claims are getting filled out each month. And then just an analysis on that. Do you have any questions for me?
Sure.
Sorry, I know that's a lot of information.
No, thank you. That was awesome. I appreciate that. That was great. So back to the denial code, PR 242.
Yes.
So I just want to make sure I understand this right. So if they use that, I mean, you gave us the direct down, we get 0 from them or the secondary for Medicare. Okay. So basically they just get to decide what code they want. There's nothing. Okay.
We can develop the PR 242 response.
That is,
Yeah.
wow. So there's nothing that governs it, which is why it might become legislative.
And there's a veterinarian.
That is crazy. Okay, just wanted to make sure I understood
I
that.
can see why that is a legislative issue.
Yeah.
And it'll take them a long while to grind that sausage.
Oh, yeah, it's gonna.
We're hoping, there is
more
a
business accounts.
slot open in our training in June, where we kind of discuss those things. We're hoping to get that on the agenda to see if we can discuss that further, maybe with an attorney to see what our options are as far as going after these insurance companies to get that payment.
And this will be limited to a state action, even though it involves a federal program.
So, right now, we have a large majority. Right now, we've been trying to tag all the claims that are getting these denial codes, which is a pretty significant number.
Really?
For patients that don't have Medicaid as a secondary, that balance that they don't pay does go to the patient. Unfortunately, there's just not a lot we can do about that, but as far as our Medicaid secondary payers, that it's causing a very large issue because we can't bill the patients that they have Medicaid coverage.
Is there mainly one or two of the secondary payers who are exploiting this, or is it across the board? And then follow up, would our legislative points of contact be simply our state rep and our state senator? Have we talked with them about this issue?
We have not personally, but the Missouri Ambulance Association is getting in contact with them to see if they can at least look into it to see what they can do.
It wouldn't hurt, Chief, to lean on them from a specific point to a specific legislator.
Yeah. Any other questions?
Thanks again, Katie, appreciate it.
Now to take a motion to go into closed session pursuant to RSMO 610.021, section 1.
So moved.
Second, all in favor?
Turkey,
Yes.
Grace,
Yes.
Steve,
Yes.
Walker,
Yes.
West.
Yes.